Hello guys, welcome to the another episode of Run with Lalita. Today we will going to discuss about a journal topic. Let's talk women's health. Woman is such a powerful creation of God which helps in sustaining life on this planet. In today's time or in present scenario, where everyone is busy with their personal and professional life, we sometimes forgot to talk about our health, which is very important. So this video is dedicated for all the women, whether they are working or non-working, whether they are busy in their professional workers, managing business roles, performing different roles in the corporate sector, whether they are housewives, and for every women and girls watching out there. So in this video, we will going to discuss about the what are the issues and challenges which women are facing in present time, and further we will going to also discuss about the what are the precautions, suggestions, and the treatment they can take. So let's start the today's video. Firstly, we will going to discuss about what is ovulation, what is menstruation cycle, and what are the types of disorder associated with it. Firstly, ovulation. It is a process where our ovaries produces eggs once in every month, and if it get fertilized, then it further develop into the fetus, and if not, then it shed out in the form of period bloods from a uterus. In layman terms, ओवुलेशन एक ऐसा प्रोसेस है जिसमें हर महीने हमारी ओवरीज एक एग रिलीज करती हैं. अगर वो फर्टिलाइज हो जाता है तो वो आगे फीटस की फॉर्म में ग्रो करता है, एंड अगर वो फर्टिलाइज नहीं होता है तो वो हमारे इन दी फॉर्म ऑफ पीरियड ब्लड्स की फॉर्म में हमारे यूट्रस से बाहर मूव आउट हो जाता है, जिसको कि हम दूसरी भाषा में महीना आना भी कहते हैं. Now let's discuss about what are the types of disorder which are associated with it one by one. Firstly, we will going to discuss about what is endometriosis. Second, we will going to discuss about what is PCOS or PCOD. Third, we will going to discuss about what are uterine fibroids. And last, we will going to discuss about what is cervical cancer, which is most important. So first, what is endometriosis? Endometriosis is a medical condition in which the inner lining of our uterus will get deposited on the outer uterine walls, on the outer surface of the uterus, on the fallopian tubes, and on the rectum area. और इसको दूसरी भाषा में समझाऊँ तो एंडोमेट्रोसिस ऐसी मेडिकल कंडीशन है जिसमें कि हमारे जो यूटस के अंदर स्मॉल ब्लड कैपिलरीज होती हैं, जिनको कि हम वेन्स भी कह सकते हैं, वो हमारे धीरे धीरे यूटरस की वॉल्स पर, हमारी ट्यूब्स पर, हमारे रेक्टम एरिया पर जमा होना स्टार्ट हो जाती है. एंड इट विल फर्दर क्रिएट प्रॉब्लम्स लाइक सीवियर पेन बिफोर एंड ड्यूरिंग द पीरियड्स, constipation problems, gastric problems, heaviness in the abdomen region, severe pain in pelvic area, sensation of vomiting, nausea, tiredness, anxiety. So these are the etc. These are the symptoms which are associated with it. Now, second is what is PCOS or PCOD. PCOS stands for polycystic ovary syndrome, and PCOD stands for polycystic ovary disease. Firstly, syndrome is there which convert into a disease. Syndrome is a type of bacteria or germs which further develop or further grow in a form of particular disease. पहले एक बैक्टीरिया होता है जो कि धीरे धीरे ग्रो करता है और वो फर्दर एक डिसीज में कन्वर्ट हो जाता है, विच वी टर्म्ड एज PCOS to PCOD. So now what is PCOD or PCOS? It is a medical condition where our ovaries start producing immature eggs or partially mature eggs. ये एक ऐसी मेडिकल कंडीशन है जिसमें हमारी ओवरीज इमेच्योर एग्स प्रोड्यूस करना स्टार्ट कर देती हैं जो कि वेल डेवलप नहीं होते हैं. एंड द सिम्टम्स आर द वुमेन मे फेस problems during conceiving, and this is also because of the hormonal disbalance. So now third type is, what are uterine fibroids? Uterine fibroids are the growth of non-cancerous cells inside a uterus. It is also sometime passed from hereditary traits, or in the another way we can also say hereditary traits are also responsible for this type of disorder. यूट्रिन फाइब्रोइड एक ऐसी टाइप का डिसऑर्डर है जिसमें हमारे यूट्रस के अंदर मांस की गांठें बन जाती हैं, एंड द प्रॉब्लम और सिम्टम्स एसोसिएटेड विद दिस टाइप ऑफ डिसऑर्डर आर heaviness in the abdomen region, heavy bleeding, severe pain during or before the menstruation cycle. Even sometimes it will not control from the painkiller or medications or injections as well. And other symptoms include heaviness, sensation of vomiting, uh, anxiety, tiredness, uncomfortableness in the pelvic region. So these are the symptoms which are associated with this problem. Now these are of four types. Firstly, intramural. Second type is submucosal. Third type is subseral, and last is pedunculated. So let us discuss one by one in detail. First type of uterine fibroids is intramural. These are the uterine fibroids, or the growth of a cell which are present inside the wall of uterus, और इन लेमन टर्म्स इंटरम्यूरल एक ऐसा टाइप है यूट्रिन फाइब्रोइड्स का जिसमें अब जो मांस की गांठ है वो हमारे यूट्रस के अंदर इनर वॉल पे बन जाती है. सेकेंड टाइप इज सबम्यूकोसल. In this type of uterine fibroids, the uterine fibroids or the growth of cells, unwanted cells, will start growing inside the lining of the uterus. सेकेंड टाइप सबम्यूक्सल है जिसमें कि जो मांस की गांठ है वो हमारे यूट्रस के अंदर जो लाइनिंग्स होती हैं, जो ब्लड कैपिलरीज और वेन्स होती है उनमें बन जाती हैं, जिसको कि हम सबम्यूक्सल कहते हैं. नाउ थर्ड टाइप इज सबसेरोल. दिस टाइप ऑफ यूट्रिन फाइब्रॉइड, the growth of cells or the uterine fibroids will start developing outer walls of the uterus. सबसेरल टाइप में यूट्रिन फाइब्रोइड्स के टाइप में जो हमारी मांस की गांठें होती है वो हमारे यूट्रस की ऊपरी सतह पे बन जाती है. नाउ लास्ट इज pedunculated. In this type of uterine fibroids, the uterine fibroids is attached via stack in the uterus. फोर्थ टाइप जो है हमारा pedunculated. इस टाइप में जो हमारी मांस की गांठ होती है वो यूट्रस के बाहर की तरफ लटकती है. So these are the types of the uterine fibroids. Now last we will going to discuss about most important, cervical cancer. Now what is cervical cancer? It is in this type of disorder, unwanted growth of a tissue is present on the cervix part, which is present inside our uterus. इस टाइप की पर्टिकुलर डिसऑर्डर और डिसीज़ में जो एक अनवांटेड सेल की ग्रोथ हो जाती है हमारे सर्विक्स वाले रीजन पे, जिसको कि हम सर्विकल कैंसर का नाम देते हैं. एंड नाउ व्हाट आर दी रीजन्स which are or causes which are responsible for this type of disorder. Basically it is a sexually transmitted disease, and other causes include lack of or weak immune system. Second, use of more contraceptive devices or pills. Third, having sexual relations with more than one partner. And these are some of the main causes which are responsible for this type of disorder. Now we will going to discuss about how we can detect cervical cancer. For cervical cancer, screening test is there. It include pap test, pap test. Now what is pap test? It is a type of pelvic examination in which a gynecologist or doctors will insert a speculum which consists of a small tiny brush, and the from the cervix part the tissue or cells are collected, and it is further put it on a slide for the further detailed examination in the labs. And it will take about 15 days for the reports of this medical test. And after, if the test is negative, then there is no problem, and if it comes out positive, then the gynecologist will uh, advise you the treatments and the precautions further for it. So now, uh, what are the government initiatives taken in this regard? So, under the Universal Immunization Program, or under the Universal Immunization Vaccination Program, this program under this program, a vaccination program is launched, which especially targets the adolescent girls having age 14 years or more, uh, is vaccinated through this campaign, and it is officially started from 2023. In under this campaign, India also developed its first indigenous cervical cancer vaccine to treat this type of disorder, which name Cervavax, and it is also for women as well. Basically, HPV vaccine. This is a vaccine which is indigenously developed by our India, named Cervavax. It stands for human papillomavirus, and it is a huge campaign running worldwide within the India to treat this type of disorder. And also, according to the PIB report, official report, with 1 out of every 5 women is suffering from cervical cancer in India, and with 25% deaths are reporting with this type of disorder in India. So this is the official data which I have taken from the PIB, Public Information Bureau website. It is a government website, uh, from where I have taken this data, and this is all about the today's video, in which we will discuss what are the issues and challenges associated with today's lifestyle and with the busy schedule, as everyone is engaged and busy with their professional and personal lives. So these all are the types of disorders, their treatments, precautions, and if you feel any of the symptoms, so just don't worry about, and just book a consultation with a gynecologist expert, and it will suggest you the further medications or the treatments which are associated with this. Now, lastly, I am going to discuss what are the treatments which is required for treating the endometriosis, PCOD or PCOS, and lastly the uterine fibroids. So basically, what are the treatments which are available for these three types of disorder? In initial stages, the gynecologist or the doctor will take the patient in medication, and if it is not work, or if the disease is on the second or the third stage, then the uh, gynecologist doctors will suggest you a 3D laparoscopic surgery. Now, what is 3D laparoscopic surgery? Let's discuss a bit about it. It is different from normal operation or normal surgery. In this type of surgery, basically a two small incisions will made below the pelvic region or below the abdomen region. In one part of the incision, a 3D camera is inserted, and in second part of the incision, a medical cutter or instrument is inserted from which the uterine fibroids or the infection which is present on the uterus is removed or cleaned from the uterus. And uh, it is carried out under a great precision and the expert laparoscopic surgeon. So it is a far better than the normal surgeries. Now, what are the advantages of laparoscopic surgery? Firstly, it prevents loss of blood. Because of two small incisions, there is no chances of loss of blood. Secondly, the patient will get a quicker relief, or the recovery will get faster. Within the 3 weeks, the patient will get recover fully. Thirdly, the patient will discharge on the same day, as this procedure max to max take 30 to 45 minutes, not more than that, and it is carried out under the great precision and the expertise of laparoscopic surgeon, which were having their degree from abroad also and within the India also. So it is advised by the doctors, as it is safe and there is no chances of having loss of blood. The patient will get the relief on same day, and it also help in quick recovery of the patient after the surgery. So these are some of the advantages of laparoscopic surgery. और in layman terms में समझाऊँ तो laparoscopic surgery एक ऐसी सर्जरी है जिसमें कि जो एब्डोमेन रीजन होता है, जो पेल्विक एरिया होता है हमारा स्टमक के नीचे का, वहाँ पे स्मॉल छोटे कट लगाए जाते हैं, एंड एक कट में हमारा 3D कैमरा जो इंसर्ट किया जाता है, दूसरे कट के थ्रू मेडिकल इंस्ट्रूमेंट जो कि कटर होता है उसको इंसर्ट किया जाता है, उससे जो यूट्रस के अंदर यूट्रिन फाइब्रॉइड्स हैं उनको रिमूव किया जाता है, और जो इन्फेक्शन है यूट्रस पे उसको क्लीन किया जाता है. सो इसको कि हम लैप्रोस्कोपिक सर्जरी कहते हैं. This is all about it. And for this is all about today's video, and if you get helpful insightful knowledge, so please keep like, share and subscribe this channel for more informative sessions. Go watch and like this video. Thank you.